Hi, my name is Ava Cochran. Today I will be demonstrating how to dress a surgical wound. So it is important when caring for an open wound, it must be done correctly, and open wounds, they're an entryway for bacteria to get in, and that can eventually cause infection. So proper sterilization techniques need to be used, and if it's done incorrectly, it can lead to cellulitis or impetigo. And this is types of skin infections from certain bacteria that can lead to a, um, a spread of bacteria. So in order to dress a wound, you have to have the correct supplies. Sterile gloves are the most important because they help prevent the spread of bacteria or infection. And you have to begin with washing your hands, and then you remove the old dressing, and then you clean the wound, and then you apply new dressing. So you wash your hands, remove dressing, clean, and then apply new dressing. So step one, you want to gather all your supplies. You want to have them right in front of you so you can grab them easily as you are dressing the wound. And so you want to have sterile gloves, which is the most important thing you need to have, like I said, to prevent infection. Saline water, scissors, antibiotic ointment, rolled gauze, and tape or wrap. So the second step, you want to wash your hands. You want to do this for a minimum of 20 seconds. I would do it for even longer, but you want to make sure you wash all parts of your hands, get underneath your fingernails, and then you want to put on your sterile gloves after you have dried your hands off. So step 3, you're going to remove the old dressing. There are some sticky parts where the gauze might stick to the wound because of blood and other substances, so you want to put the saline water on to help loosen that up and carefully peel it off of the wound. If you just don't use the saline water, it could injure the patient, and it could tear dead skin off that is used to help heal the wound. So you really don't want to tear that dead skin off. That's why saline water is used. Okay, next step. Step 4, you want to clean the wound. You need your saline water again, and you want to wet the gauze with the saline water and pat the wound. You don't want to rub it because then again, you will tear off dead skin. So you just want to pat the wound, and you just want to look for any blood or any other fluids that you might see in the wound or around the wound. Okay, so step 5, you want to apply new dressing. You want your antibiotic ointment, so you want to rub that on the wound to help it heal. Keep in mind you still have your gloves on, your sterile gloves on, and then you're going to apply a nonstick pad, and then you're going to wrap the gauze, and then you're going to wrap the wrap around the gauze, and then the tape. Be careful not to take any old tape off because it will tear off dead skin and it might damage the wound. So it is important to follow each step correctly, because if done incorrectly, it could injure the patient. It may seem simple, but it needs to be done safely. And remember, it's just only 5 steps. Gather supplies, wash your hands, remove an old dressing, clean the wound, and apply new dressing. And these are my works cited.